Sometimes the greatest threats are the ones we do not see coming. It shows no obvious sign but affects us forever. Today we'll be looking at a health condition that affects women globally, and it is cervical cancer. Today we'll be looking at what it is, stages, treatment, and more. As always, you're welcome to the program Your Health, where we look into health issues that affect us generally. I am Salamat Uzioma Lukman. But before we go into our discussion with our doctor, let's look at the benefits of these fruits, and we shall be right back. That was on papaya, carrots, and oranges. They help eliminate harmful substances that damage the cervix. And of course, they help improve our immunity. Now let's move to our discussion with our doctor, as she'll be enlightening us more on what cervical cancer is, treatment, and more.
Cervical cancer is the cancer of the mouth of the cervix. It is the fourth most common cancer in the world, and it is the second most common cancer and the second leading cause of death for cancer in women in Nigeria. Cervical cancer is caused by an infection that is sexually transmitted. A higher percentage of cervical cancers are caused by the HPV, that is human papilloma virus, which is just a sexually transmitted disease that, if left untreated, can turn to cervical cancer. It can be asymptomatic before it turns to cervical cancer, and it can take a very long time before it advances into cancer. It gives a very long window for detecting that infection and treating, known as the precancerous stage. That is when, if a woman goes for screening, it can be seen and it can be treated just like any other infection. But once it becomes cancer, symptoms like intramenstrual bleeding, bleeding between menstrual cycles, bleeding after sex, that is postcoital bleeding, or postmenopausal bleeding, which is bleeding after a woman has reached menopause and have stopped seeing her menstruation. Those are signs of cervical cancer. Other symptoms like unusually foul-smelling discharge, unusually watery discharge, that is, unusual, and also unusual pelvic pain that is unexplained, that comes with whether it is foul-smelling discharge or bleeding. This can all be signs of cervical cancer, but it cannot be ascertained unless a woman goes for her screening and a pap smear is done and it is detected. Generally for cancer, which includes gene or hereditary factors. Some cancers comes with hereditary genetic factors, and there are some genes in the body that makes you susceptible to or prone to developing cancers. But majorly for cervical cancer, immunocompromised women are at higher risk of developing cervical cancer and also dying from it. It can be just low immunity from some other illness, or women that have HIV or other immunodeficiency diseases. And there is also multiple gestation and childbirth is also a risk factor. There are some kind of contraceptives that are also suspected to be a contributing factor. For example, using the pills for a very long time, longer than 5 years, has been proven to be a risk factor for cervical cancer. So sedentary lifestyle, lack of exercise, always be in one place, that is a very lifestyle plays a very important role in prevention of cancer. Exercising, being always ambulant is a very good way of life. So I think a good and healthy lifestyle is a preventive way. There's also what we eat. What we eat can also be a contributing factor. I think it can also be a part of healthy living. We need to generally have live healthy, eat healthy, and that can be a factor for cervical cancer too. Alcohol and smoking have been a very high contribution to the incidence of cancer, and also the same for cervical cancer. And I think maintaining our immunity to be optimum is also a way of protecting ourselves from all forms of cancer and also cervical cancer. Once a diagnosis is made, a woman needs to see an oncologist to begin treatment. But the first line of action is to go for use diagnostic tools to stage the cancer. The staging can be from early, whether it's detected early or it's advanced, which is staged from 1, 2, 3, or 4. Stage 1 and 2 are considered early, and the prognosis is better. There is the chances that it can be cured completely. You know that once cancer is advanced, it is more complicated to treat, and the chances of survival is also going to be low. But generally, no matter what the staging is, treatment is expected to commence immediately, from surgery to chemotherapy and also radiotherapy. Those are the major ways that we use to treat cervical cancer. So when cancer is diagnosed early, the whole point of early detection is that it gives us more hope that this cancer can be treated completely, and because any advancing in cancer, it might have been locally advanced, spread within the organ, or it may have advanced to other organs. For example, cervical cancer that have advanced to the brain is considered an emergency, and also advancing to the spine is also an emergency, because that can render a woman paralyzed. So that is something that is the reason that we encourage early detection, because by that time there are no advancements and there are less complications, and the cancer is easier to treat. So the role of radiotherapy in cervical cancer treatment, boils down to using radiation to kill the cancer cells, um, especially for cases that are locally advanced or confined to the organ. We use radiotherapy and brachytherapy. Radiotherapy is the external beam radiotherapy, where we use a linear accelerator and target our beam to treat the cancer. And afterwards, an internal beam radiotherapy known as brachytherapy is also used internally to target the organ from the inside. Both have the same goal, to use radiation to kill cancer cells. Radiation have the ability to kill all cells, but the human cell, the normal human cells, has the ability to regenerate. So while the treatment is ongoing, as a professional, I'm expected to explain to the patient what to expect during treatment, the side effects to expect, how to take care of themselves during the treatment for both radiotherapy and brachytherapy. And this is a crucial time where our patients need so much support, and most importantly, they also need counseling. We try our best, and we also advise counseling at this stage. For prevention of cervical cancer, a woman is advised to go for regular screening, which is timely. There are two kinds of tests, the pap smear and the HPV testing, which are both very effective ways of checking for any changes or precancerous lesions that can lead to cervical cancer, so that it is tackled early before it becomes cancer. So those are the preventive measures. Pap smear, every woman should go for a pap smear every 3 years. And for HPV testing, it can be done every 5 years, because the HPV DNA testing is the most effective way. And once a woman takes this into action, I think this is our way of eliminating cervical cancer. Apart from that, the HPV has a vaccine that can be given to women before onset of sexual activity, which has been proven to be very effective against different forms of human papilloma virus, which is a virus that is just sexually transmitted, but can cause a higher percentage of cervical cancers and also other cancers, not just cervical. So that vaccination is a sure way of eliminating cervical cancer for the future, especially because we are tackling it early in younger girls. It is also effective in older women that are already sexually active, but we advise more of screening for women that are already sexually active. So far for the free HPV vaccination that have been launched last year by the government, there are a lot of myths surrounding it, which as advocates we are trying to correct, because the society feels, why are we getting this vaccine? We don't know. First of all, there's no awareness, there's no education. We need to do a lot of awareness and educate the people on the importance of the vaccine. Recently, I underwent a research for the uncertainties of HPV acceptance in Nigerian communities, and a lot of people have no idea what HPV means. Talk more of taking a vaccine for it or allowing their daughters to take a vaccine for it. HPV is a virus that can cause cervical and other cancers, and taking the vaccine is very effective and also safe for the girls. And I think we have to create a lot of awareness and educate the public about the importance of this vaccine, and also do away with all the myths surrounding the vaccine, where people say it's going to cause HIV, it's going to make them infertile. All those are just myths, and we shouldn't be spreading these kind of myths. We should spread awareness and not misconceptions. So the HPV vaccine is effective in prevention of cervical cancer, and is a way that other advanced countries have used to have total elimination of cervical cancer. Cancer treatment comes with a lot of side effects, and we all know that some people opt for local traditional medication to avoid those side effects, because they believe the side effects are more dangerous than the disease itself. But that is also another myth. The side effects can be controlled. The patient can be educated on how to take care of themselves. Specifically for cervical cancer, the side effects that comes with, for example, radiotherapy and brachytherapy as a major treatment for cervical cancer is it can cause diarrhea, it can cause loss of appetite, and it can also cause scarring, or what we call radiation dermatitis. All these are things that can be managed and controlled. It can come with other side effects like anemia, where we advise our patients to go for PCV testing to check their blood level, and adhesion, specifically for cervical cancer. There are patients that experience adhesion after treatment, where the vaginal canal comes together and have an adhesion. Those things are also very much preventable. So after treatment, patients are advised to come for regular follow-up and in a timely way given by their doctors and their caregivers. And it is very important for patients to keep up to those appointments and follow up, do some diagnostic checks in a timely manner to check for reoccurrence, because we know that one thing that comes with cancer, and the biggest fear after surviving cancer, is knowing that no matter how long, cancer can resurface. But before it happens, it can be seen early. So time is of the essence when it comes to cancer treatment, and also follow-up after cancer post-treatment. It is very important to go for diagnostic checks, for example, CT scans, MRI scans, and blood tests, that's lab tests, that can have pointers that will show the situation, that will show whether there is anything going on, whether there is reoccurrence, whether there is a regrowth of the tumor, and also whether there is advancement to other organs, advancement to the pelvis region, to the bones, to the spine, or to the brain, can be very dangerous for the patient and also prove to be deadly. So it's very important for follow-up procedures and follow-up checks.
From that interview, we got to find out that screening and vaccination can help eradicate cervical cancer. So let's endeavor to go for checkups regularly. Now let's go for our health tips. Avoid multiple partners and use barrier methods like condoms to prevent HPV infection. Now let's go into our Did You Know segment. Welcome back. From that, we got to find out that cervical cancer is the second most common cancer that affects women worldwide. Now, let's go on a quick break, and when we come back, we go into our interactive segment. Welcome to our interactive segment where we'll take your questions, comments, and suggestions. You can also be part of this by sending your messages to the numbers displaying on your screen if you're just joining us for the first time. Our first question today is from Josiah Ojo. He sent, "Good day, presenter. I love the program, your health. Please, I have a problem. I have catarrh and it smells badly. I have seen a general doctor about it and I was given antibiotics, but there is no improvement on the smell. Please, what should I do? It is really embarrassing." Well, Josiah, sorry about that, and thank you for watching our program. From our doctor's advice, he advised that you see an ENT doctor, and I'm sure he'll find a lasting solution to your problem. Our next question today is from Mabel James. It goes, "Please, presenter, can you bring a doctor to talk on hepatitis?" Well, Mabel, thank you for also watching our program. We'll bring a doctor to look into that soonest. And these are all we're taking on our question and answer segment today due to time. Let's go on a quick break and we shall be right back. Welcome back. This is where we draw the curtain on today's episode, which was on cervical cancer. We hope we have empowered you with enough information to fight against cervical cancer. Do stay healthy and remain blessed. Until we come your way, same time, same station next week. Remember, your health is in your hands.